So joining me here right now is Dr. Mona Hanna-Attisha, and I feel like I've introduced you a couple of times here. Of course, you are a pediatrician based in Flint and working with Michigan State University, and you have been a champion for women and children, and really more being proactive on the health side instead of just reactive.
Absolutely.
And it's so good to have you here.
It's great to be here in person.
I know, in person in the Zoom world. When it feels like
I love people. I love touching people.
She did hug me when she came in. So, but you and I have talked many times before, and you wrote about your experiences with Flint. And tell us a little bit about RX Kids and this new program that you're working on. And then I think I'd like to take a bit of a wider angle lens on how this can help.
Absolutely. So I'm so excited to talk to you about RX Kids. It is a never before done in the nation effort to really prevent poverty when it's the worst. We are going to be giving every mom, every pregnant mom in Flint, and every baby unconditional, universal cash allowances. It's going to be prescribed. So I prescribe lots of things, and we do so many good things in Flint, but we fail to really address the root causes of what makes people sick and what really limits their opportunity. So this is a prescription for cash to uplift our young poverty.
So this is a woman is pregnant, she comes to her doctor, and they write a prescription, and it's $1,500 for anything. That's rent, utilities, formula, diapers, anything.
It's a one-time cash allowance in mid-pregnancy, which is $1,500, and they can use it for whatever they want. We have lots of great programs out there, like, hey, come get a backpack or come get this food, but it's not often what families need, and there's a disconnect. And this is about not just prescribing cash to disrupt poverty, but it's also about trusting families and giving them the dignity to make their choices to determine what they need for themselves and their family.
Because they do know what they need.
They do know what they need. My kids, like, I love my kids, you love your kids. My patients, they love their kids just like we love our kids. And we need to enable them to empower them to make their best choices.
And once that baby is born then, $500 a month for the first year of that infant's life. And again, just to be able to get what people need.
It's economic stability. It's knowing that every month you can expect another $500 to meet your needs. We picked this time period, this kind of prenatal infancy time period, because that's like the most critical time period for brain development and children's development. Like, really what happens during that time really can predict life course. And then if you look economically, it's actually also the same time when families are the most poor. That perinatal period, moms lose income when a baby's about to be born. Babies need stuff, they're expensive. And that poverty, spikes until the first year of life. So it's the most economically vulnerable time, and it's also the most neurodevelopmentally vulnerable time.
Is there any pushback on this, Dr. Mona? About saying, well, we should put parameters on this money, or we should know what they're spending the money on?
We haven't heard much pushback, and I think because this is really based on science. There's global evidence on child allowances. Like, this is not some like crazy awesome new idea in Flint, like it is, but it's done all over the world. So we're really leaning on global evidence. We're also leaning on evidence from here. So during COVID was terrible, but we also learned how to take care of each other. We expanded the child tax credit, which lifted 4 million kids out of poverty. So we also know that when we did this in the US, it worked, and it improved all these health outcomes and nutrition security and stress, and families spent that money on what kids needed. So this is based on global domestic evidence, and it ends at 12 months. So I think that we haven't gotten much pushback because folks can't really talk about dependency or work requirements, all these other things.
No, it's a specific time. So talk a little bit about the funding. You've received funding from the Mott Foundation, and the state of Michigan has now come through with about $16 million as well.
So this was just a big aspirational idea, and it needs a lot of money. We need about $11 million a year to do this. Our first funder was the CS Mott Foundation, which is based in Flint, and they gave us a $15 million matching grant, which means we had to raise another $15 million to unlock those dollars. But as we've talked to funders and foundations and donors, there's so much joy in this program. They're like, finally, like not a Band-Aid, finally something that addresses like a root issue that has the promise not just to stay in Flint, but really to spread across the state and the nation. And then the last big chunk of money we received was from the state. So when Governor Whitmer signed the budget a few weeks ago, in it was money for RX Kids to really prove this concept. So once again, we can share it across the state.
What what was the idea in the room? And where, I mean, when you said this could be simple enough to do, who did you share it with?
This came from I'm still a practicing pediatrician. I was in clinic this week and I took care of newborns and babies and older kids, and it is joy. And when I have a baby in my arm, Christy, and I'm doing everything I can do for them, and they're staring at me with their wide eyes, I get so frustrated that I cannot prescribe them the ability to disrupt poverty.
To have security.
To have security, to make sure that kid can be anything they want to be. And when you are born into and grow up in poverty, and Flint is the poorest city in our state, it is really hard to grow up healthy and successful. We do big things in Flint. We do impossible things in Flint. And I want to connect this to labor. The UAW was born in Flint. Labor and this vision of how we should live was born in Flint. And this continues that vision that we can fight for a better tomorrow for families.
This is going to make a big difference, and other people will be watching this in other areas of the country. You have been, sounded the alarm, of course, in Flint back in 2015, and continue to use your voice. I think maybe when some people say, "Do you think that is the best idea?" What is that you can share with other people about trying to either listen to your gut, backed with the data, and keep pushing for things that you believe that can happen?
Yeah, I have this amazing microphone, and I get to talk to especially a lot of young people, and I share a few simple tips of like how to use their voice. And I tell folks to first find their passion. Young kids right now, they care about so much. All of us, you turn on the news, there's so much to care about. So find your thing, because I think if we care about so much, it's overwhelming, and then there's a lot of burnout and fatigue. So find your passion, and for me, I think it's clear my passion's kids. That's what keeps me going. That's what wakes me up. That's my North Star. That's my why. When I am down, I remind myself, what is it, Mona? It's kids. Why am I here? It's kids. So find your why, find your passion, and then stay persistent. Change doesn't happen overnight. Play that long game. Nevertheless, she persisted. So keep at it. And then I think my last bit of advice to create change and to raise your voice is find your people. My work is not done by just me. It is done by a village, and often a village of sisters, but a village of folks who also care about the same thing. And it's an unexpected village. My partners in this work, this work was brought up from parents and kids and community members and data. So find your unexpected partners. So have a passion, stay persistent, and find your people.
How is Flint doing?
Flint is amazing. So I hope everybody comes to visit. We have put into place so much awesome since the water crisis. January or next 2024, we're approaching the 10-year anniversary of the water
switch. Yeah.
And I want people to go away, yes, the story was a story of a crisis, but it is also this amazing story of how people came together to fight for a better tomorrow and have really kind of walked in that talk. We have put into place so much goodness for our kids that has made a national, a footprint. The Infrastructure Act, we're replacing lead pipes across the country, and that's because of Flint. So much of what we've done in Flint, we've been able to share across the state and across the nation. And that's also where we see RX Kids. Yes, we are starting this in Flint, but it is rapidly going to, spread across to help kids in communities that are suffering from the same kinds of adversities.
Yeah, how can people learn more about the program?
Yep, FlintRxKids.com. We're still raising money, so if anybody wants to donate, FlintRxKids.com. But it will start in January for all babies born in 2024. So move to Flint. Come move to Flint.
and expected mothers too. Who come
pregnant
into their doctor.
pregnant moms and babies.
Are we doing enough? Do you think? And sometimes you talked about the Infrastructure Act and replacing lead pipes. Are we still doing enough though when it comes to thinking about being proactive about our kids' health and in mixing with our infrastructure and environment in the state of Michigan?
Yeah, Christy, we've done great things in Michigan. We've done great things in the nation that has given me a lot of hope where we've invested in prevention. But we need to do a lot more because we've chronically disinvested in public health and in infrastructure and really in the basic ingredients of what keeps people healthy. That's what public health is. And I think we've also learned that lesson in COVID. So when you think about what kids need, safety and stability and healthy food and supportive families and neighborhoods, safe neighborhoods, and all these different things. And we can do a lot more. And RX Kids is a vision of once again, how we build that social contract, how we can really care for each other in an inclusive, dignified, loving way.
Yeah, first program of its kind in the country. So
first in the nation.
We cannot wait to see what happens. Thanks so much, Dr. Mona.
Thank you, Christy. It's
for
great
being
to be
here
here
with me.
Thank
All
you.
right.
Thank
Thanks
you.
so much. Have a good weekend.
Thank
And we're
you.
going to keep track of what's going on.
Awesome.
All
Thank
right,
you.
good stuff.
Thank you.